up?
We're being live streamed. Oh, I had somebody ask me if it was going to be recorded.
Yes, it's going to be recorded and it's going to be live streamed. So yes, we are live streaming and I'm going to record this. So
hi, Aoife.
Oh, excellent. I can hear myself in my ear. That means that we are live. Okay, and from my own Facebook profile. Hello, everybody. We are a little bit late, but I'm here with Lisa. I'm just going to go in from my profile where you should all be seeing us to share this in the Yoga Teachers Forum. So everyone, bear with me a second while I just get all the technical stuff happening. Why can't I see us? We want to just share this. So let's see if we can share this video. Everyone bear with me as we figure out some of the technical stuff. So just 1 minute and we're going to get going. And I apologize for the delay. Here we are. Okay. So I'm just going to share this into the Yoga Teachers Forum because this is a conversation that is going to be happening in the Yoga Teachers Forum. It is being recorded. Anyone who can't make it live, you will be able to get it on the replay. Just bear with me 1 second. Here we go. Okay, so we are Women's Health Conversations. Okay. Okay, I think we are in all the places on Facebook that we need to be. Thank you everyone for your patience. As I mentioned, we are running a little bit late because my journey home was interrupted by a car accident that thank God did not involve me, but made my journey home a little bit longer than I had anticipated. I am super, super excited to be joined here today by Lisa. Lisa's going to introduce herself. Some of you may know me already, but I will introduce myself. This conversation is happening in Zoom with live participants. So those people who are here with us live in Zoom, as we go along this conversation, you can ask questions. You can ask questions in the chat and Lisa and I will respond. If you are watching in Facebook, whether it's on my personal profile or in the Yoga Teachers Forum, you can ask questions in the chat, in the comments, and we will either respond to you while we're talking, or if not, we'll get back to you after our conversation. So any questions, any comments, feel free to put them in the Zoom chat here with us or in the Facebook chat with us, and we will answer you. Okay, I'm going to introduce myself. Lisa, you introduce yourself, and then we're going to start our conversation. So, hi everyone, I am Jacqueline. I am a menopause coach, a hormonal health specialist, and a yoga for women's health instructor, also a therapeutic yoga instructor, also a pregnancy yoga instructor. And in the Yoga Teachers Forum, I run the women's hormonal health training. And actually there is a training, a 4-part series training that is going to be happening in March. So I will put the registration links and all the information about that training in the comments in the Facebook group. But that is me in a very, very small nutshell. Lisa.
Hi, Jacqueline. Thanks for having me. Hi, everyone. I'm Lisa de Jong. I am a women's health coach. So I work with people who want to journey the journey of menstrual cycle awareness, hormonal health. I also specialize in chronic pain and the nervous system, and I do a little bit of work on relationships as well as part of that. And then I also do professional training in that area for anyone who wants to integrate menstrual cycle awareness and nervous system work into their professional practice. I'm in Ireland, I'm in Dublin, I'm half Dutch, half Irish. That's me. Yeah.
Amazing. So we've got a lot to talk about today, and some of it may ruffle some feathers. Some of it is sort of slightly changing the conversation, changing the narrative around women's health, hormones, cycles, trauma. There's a lot for us to get through. But one of the things I want to start with in preparation for our session today, I looked back again at some of the resources I'd collected about women's participation in medical clinical trials. And I think this is a great place for us to start, because it opens up the conversation about the way that women and women's health is viewed in general in the Western medical care system. And I don't think many people realize that women were not included in research and drug trials really up until the 1990s, and that it was perceived by researchers that women were unreliable data sets because of potential childbearing, because of fluctuating hormones, because of all different women's experiences that made them a not very good control group, whereas men were very stable, very neutral, very static. You could track them over, the course of a research study or a drug trial, whereas women were perceived as being much more unreliable data sources, which has meant that women have just been excluded from the whole research part of medicine. And we know that the medicine that is practiced in the doctor's surgery is very much based on research, scientific papers, data, dosages and drugs that are prescribed, are absolutely a function of drug trials and research. So this whole sort of conversation really starts way back in not just what happens when you're at the doctor, not just about the conversations around women's health, not just the fact that we know, and we're going to talk about later, that women's health issues don't get diagnosed, things like endometriosis, PCOS, fertility challenges. It goes way, way back into the way that women are included in much earlier stages of Western medicine. And sort of exacerbating that point is that I have heard a statistic that it takes about 17 years for data and conclusions from research and drug trials to filter down to the local doctor that you are seeing. So 17 years, and that, on an average, and assuming that all doctors have equal access to all knowledge and all research and all, data, it takes about 17 years from the conclusions of a research paper to filter down into the doctor's surgery. And I just want to say this statistic, that only in 1993 did the US Congress write into legislation that women had to be included. We're not talking about, 1953, 1993. And if you count 17 years from 1993 when legislation was implemented, doesn't mean it was put into practice. 17 years, we're just talking about now, those ramifications actually coming into how you are served when you go to your doctor. So I'm going to lay that out there as the groundwork and ask you sort of to respond to that and to talk about how you understand and perceive that.
Well, let's just talk about the history of medical misogyny from the get-go, Jacqueline. It's basically what it is. I think it's like, yeah, it's so true. And I think we need to be really honest with ourselves as women, as leaders in this space, of what actually we're dealing with here. It's medical misogyny that goes back a long time, and I'm not afraid to say it, and it's very patriarchal. However, we still need the medical system. We can't reject, when we reject the medical system, we are denying ourselves and limiting ourselves access to helpful medical care. So that's the journey. The journey becomes, okay, when is this gaslighting? When is this medical misogyny? When am I being oppressed? When do I not have access to the right information? When is this not informed consent? How can I not experience oppressive practice? How can I advocate for myself? How can I educate myself? And then make really informed decisions about me, because this is about me, right? And it's not about doing the right thing. It's not about fixing the whole medical system. It's not about I know we all want to fight the patriarchy, but like we can't individually do that, right? As much as I've tried, it doesn't work, so we have
and I also think you're 100% right. We need to also lay very clearly out there that Western medical healthcare system is an essential part of our health journey. And we have to figure out how to understand what's going on in that system, how to use that system. But I don't want anyone, and I hope you'll agree with me, to take from this conversation that we need to reject it outright.
No, and we're not saying that. We're actually talking about the nuances here and like working with systems in a smart way. There's lots of oppressive systems in the world. Like we still need to show up for them, right? We still need to. Most workplaces are patriarchal in the way they operate. Like the 9-to-5 industrialized working model is in a way patriarchal because it doesn't honor the cycles of women's bodies. And a lot of women are, climbing the corporate ladder, single mothers, you name it, doing all of the household work, all the emotional labor at home. And we're paying the price for that in terms of our health and our fertility in our bodies. I know that's a separate conversation, but what I'm saying is, we can't escape it. We're all living in the system. So the question then becomes like, okay, let's really be honest about this. Like what's actually happening here and how can I be in my own power and agency? And how can I really see for what's actually going on? And that's been my personal journey. And that's the journey that I take people on professionally. And I know you do as well. I know that this is what the work it's about. Because if we reject the medical system, that puts a lot of pressure on ourselves to heal endometriosis with acupuncture. Not that people don't do that. I do think people do that, but that hasn't been my experience, and neither has it been lots of women's experiences.
So I agree with you. I think that we have to really be very clear and say that women's health issues, there are, I use this term and I credit it to my aunt who wrote a book with a similar title, Pathways to Healing. That there are ways and strategies and approaches that you can take to heal yourself or to go on a healing journey. One of those pathways should include Western conventional medicine, but there are also other things you can do. And both of us work in spaces that have a more integrated, holistic approach. But yes, it's got to also be with together the pathway of Western medicine, as long as my personal feeling has become that it is one of the legitimate pathways. But there are also other things we can do. And I think that when it comes to specifically women's health issues like endometriosis, PCOS, anything related to fertility, fibromyalgia has a very, very high percentage rate of women that experience fibromyalgia compared to men. Perimenopause, anything that is very woman-centric. We need to really uncover what the sources are of the root causes of those, health pathologies or challenges, and to figure out a women-centric approach, because often the generalized health approach may not be specific enough for a female perspective, and also is definitely not a personalized perspective. So what are the sources, the roots of your thing, of your pathology, of your women's health issue? Can we start peeling back the layers of why this is showing up, how this is showing up for you, and what are the strategies that would be that we would include in healing, and things that are maybe more specific for you and for your personal story. So I don't know if, Lisa, you want to give maybe a couple of examples of either clients that you've worked with or the way that you approach these types of things, and then I will give some examples.
Yeah, love it. It's such a gorgeous question, Jacqueline, because it speaks to that piece around like how can we nourish ourselves really, and how can we do this in a way that's in our own pace, where we do have agency, like I talked about, and also be open to the medical model if that is what you're wishing to do. So for me, in my work and personally, number one is nervous system regulation. It's a huge part of my work. I work from something called a trauma-informed approach. I'm polyvagal trained and training in somatic experiencing. So it's the number one thing, and it's a lot easier said than done, because our patterns come up, our old training, our old patriarchal internalized belief systems come up and tell us that we need to do all of the things, or we need to be really busy, or it's not safe for our nervous system to be calm and serene. And then we kind of, we can fall into patterns and things. I was working with a client this morning who has discomfort around being in excitement. She's having an exciting time in her life right now in her circumstance, and it's bringing up a lot of discomfort. So we're working on how we can regulate that and create space for that in her nervous system. And I can 100% relate to that. So I'm constantly like tracking my system, looking at how I can regulate, taking time, taking space, not putting pressure on myself. So that would be number one, is I take that approach to my self-care. And then in terms of practicalities, like, I walk every day. That's really important for me. I love music. I love cooking. I like cleaning is regulating for my system. Magnesium baths. Diet is a huge piece. The blood sugar, but balancing my blood sugar levels, that was a learning journey, figuring out how to do that in a way that was practical and simple. And not like hugely expensive, because some of those diets can be very expensive. And what else? Like just staying really connected with my community is really important. I also work with my own coach and my own nutritionist, so I have lots of supports. But sometimes those small little things like the music, the going for walks, doing whatever it is to regulate your nervous system, eating balanced meals, like, your sleep, it's so important. Exercise, those basics. Like if those basics aren't there, there's no point then in going for the ashwagandha and all the other things. I do like acupuncture as well. That's one of my things that I love to pay for, is going out and getting acupuncture once a month. But yeah, those are kind of the things that I turn to. There's lots more things, but I try to not add too many things on the list, that kind of way. But they're kind of the foundations of what about you, Jacqueline?
Yeah, so I'm really with you on all of that. When I work with my clients for menopause symptoms and menopause management, I use like a 5-pillar approach, which basically includes other things you do. I come at it from a creating hormonal balance point of view. I really think that with the cornerstone of women's health is hormonal health, and understanding the role that hormones and hormonal imbalance plays in our health journey throughout our life cycle. So stress is critical, and I'm actually just doing a polyvagal theory course at the moment. So I'm really into that whole, we always used to think it was sympathetic nervous system and parasympathetic nervous system, very sort of binary, and now polyvagal theory is coming up with it much more nuanced and much more sort of complex than just that simple sort of division of nervous systems. So stress, I think, is really not to be underestimated in how stress impacts our hormonal health and our body functioning in as a holistic, integrated physical being. Nutrition, I think, and again, for me, nutrition is coming from the perspective of, as you said, sort of insulin and regulating the hormone and the knock-on effects of dysregulated insulin on how the rest of our hormones interact with our body. Sleep. I use also movement. I don't use the word exercise. I find exercise can be very triggering for people, especially for women. So I use the word movement, and work-life balance with more of the focus on the life. And I want to go back to what you said about connection with your community, you've got your coaches and your own coaches that you work with, and the accountability, support, and connection. When I look at hormonal health and hormonal balance, I'm not just talking about reproductive hormones, cortisol, adrenaline, and insulin, and other hormones that may be significant, but also looking at boosting the feel-good hormones. And I don't think that enough of our work is like, we're always talking about the reproductive hormones, because the reproductive hormones for women are the most obvious hormones that go through change and that impacts us, in a cyclically. But I think the boosting of feel-good hormones, the serotonin, dopamine, endorphins, even melatonin, those boosting up of those hormones is really important for feeling good and creating hormonal balance and being able to navigate things, and the way that those feel good hormones impact all the other hormones to create a really good hormonal balance. And connection is the best way to do that. So I wonder how that plays into maybe the work that you do also, not just only looking at hormonal regulation, but the positive, the boosting.
Oh, it's so good. I love it, because I think like when it comes to this links back exactly to the point you made at the start, Jacqueline, around the pathologization of women's health. And I think the narrative we're talking about changing the narrative, right? The narrative, the change that we're trying to make is that it's not just about surviving pain and, you know, having to like fix our endometriosis, but it's more than that. It's like learning how to thrive and learning how to like experience pleasure in our bodies and with our people, and like learning how to really feel joy and love and connection, and having a really positive experience, embodied experience of our life. And it's not just about just trying to get away from pain. It's more than that, you know. And that's the thing about the serotonin, the oxytocin, the dopamine. Those are all really good hormones for, guess what? Preventing PMS and PMDD. So they're super, and they're great for boosting our progesterone levels as well. So like and I see that as medicine, and that's a really important part of this work. And we've I think we all know this, in the last 2 to 3 years with the pandemic and everything, we've lost connection, and we've all experienced the impact of that. I certainly have realized, oh yeah, my relationships are so much more important than I realized, like all of them. So yeah, when it comes to my work, I do think about that. I think a lot about my clients' capacity within their own relationships. I build my coaching practice and my group programs, and all my training is really rooted in this sort of fulfilling the need for connection and safety and intimacy and commitment to a process. Yeah, it's just really powerful stuff. Like, we don't have to pay a lot of money to heal our hormones. Like, it really, like, you know, we really don't. We can make small little simple changes. And I also want to acknowledge that for some people, relationships aren't easy. Like I struggled with relationships a lot, all my relationships. And so I've had to journey the journey of looking at that, figuring it out, feeling safe in my relationships, feeling comfortable with intimacy, feeling comfortable with being seen, with being heard, with being with someone else's stuff, you know, and that is a journey to journey. But when we do work on that piece, it's very rewarding, to heal those wounds that we have when it comes to relationships.
Yeah. I want to go back to a point that you mentioned about pain and specifically suffering, because I think that within the women's health space, suffering and pain are words that are really connected to our experiences. So I suffer with PCOS. I suffer with endometriosis. Or I'm suffering with menopause symptoms, or with menopause, or I suffer with PMS. That word suffering is always attached to the pathology that we are experiencing. And we often assume that women's health is something that includes includes suffering or includes pain. And that is sort of part and parcel of what it means to experience these things. And I think that, again, layer upon layer, you know, it's not just the physical experience that you're going through, but it's the physical experience plus societal narrative, plus preconceived ideas, plus being heard or validated by your, you know, healthcare practitioner. That add layers onto the experience, rather than just, this is just a women's health thing that, you know, plenty of women go through and experience. Let's maybe start shifting the word suffering for the word experience. And the negative connotations and the negative language also sometimes exacerbates the journey and exacerbates the experience, because we just have a negative framework that the woman sort of is put into or is tagged with. And I think that that's something, again, it's a bit more sort of esoteric, and it's a little bit more going back sort of to the language rather than the very practical strategies. I know that people want sort of, okay, great, like you've talked about this, but practically what do we do? But I think that really not to underestimate that element of the experience also, and then find some other strategies around that. How do we change our perception? And it's not just like think positive, but really understand what is going on in our bodies. And I know that you are very into cycle awareness and things like that. So maybe, I don't know if there's a way to connect those two elements.
Great question. I was just thinking that's a really interesting point you're talking about with the language piece, and it kind of speaks to the a little bit of the victim perpetrator triangle thing. I don't know if I'm sure there's coaches in this call who understand that, but essentially what that means is that when we are pathologized, or if we are suffering, because we do, what can happen is it can become our identity, and it's like this unconscious journey, and we can kind of label ourselves with being an endometriosis sufferer, and we're stuck in this cage and we can never get out. And that's what it feels like, because that is kind of what's happening, right? Because of the whole medical misogyny piece. So that's that. But then
and you also become medicalized.
You become medicalized.
Yeah.
Exactly. Yeah. And so the question then becomes like, how can we, it's quite nuanced here, so let me just find my words with this, but it's like, how can we decage, is that a word? Like come out of the cage, and how can we free ourselves and empower ourselves, but still own our suffering in a way that is part of our agency and not something we're victim to. And so you ask about how does cycle awareness come to that? The way I visualize that is that, and I know this is really cliche, but this too shall pass. So, and I'm saying that from a very real lived experience of having suffered a lot myself. I would never, like when I use the word suffering now, I use that very consciously, and I own that for myself. If I'm suffering, I'm suffering, and I need that to be seen and heard and taken seriously. And it's not just like, I'm a problem and it's because I'm a woman. Like, it's like, this needs to be addressed. But it's not who I am. Like, I am not my endometriosis. I am not my my trauma. We talked about trauma. I'm also not my business. That's another journey I've had to go on. Like, I am not, even though I have a brand and I do this work, it's not who I am at my core. Also, I'm not like, I am not my menstrual cycle. And the thing about the menstrual cycle is, from that cyclical perspective, it's not constant, but it's constantly changing. And we know it's not actually that complicated. It's cyclical. We return. So my suffering is the same. My suffering is something that visits me and moves through my body, as any kind of suffering in life. Mine just happened to be a physical type of suffering. Obviously, I've also experienced emotional suffering and mental suffering too, and we all do. It's just, rather than that becoming my identity, it's like a wave that moves through me, and I have to learn how to allow that to move through me and look after myself in the process, and not be afraid of it. So there's something there as well about softening. I have a friend who I talk to about pain. He's a physiotherapist, and he knows a lot about pain. And his definition of pain is physical and an emotional experience.
Yes.
Those two things together. And I think we have to learn how to soften into them and not identify it with them. But they are, but not completely rejected as like, oh, I can't use that word, because I think it is important to use that word. But to use it in a way that you're owning it, and it's not like it's this too shall pass kind of a way, unfortunately.
So I think you said some really important things. I'm going to relate it to someone who has fertility challenges. So I think you're 100% right. The experience and the suffering experience is real. And we're not talking about don't make such a fuss, or, don't be so silly, or, just get over it. It's not that. It is very, very real. But it's how do you engage with that suffering, with that pain, with those symptoms? Do you become, as you said, a victim of it, or can you use it to be empowered to take action from it? And I think that that's a really interesting, subtle difference. I want to relate what you said specifically to someone who is going through fertility challenges, because one of the units in my women's hormonal health training is all about fertility and understanding a fertility journey, because if you are a yoga teacher, yoga therapist, you very well may have a woman or anyone who identifies as female in your class who is going on a fertility journey. And one of the biggest things that happen is this disconnect for the person on this journey who is trying to get pregnant and can't get pregnant, that they feel their body is betraying them. They feel disconnected with their reproductive system. They feel that they just, they want this so much, and it is very much a physical and emotional journey, but there are so many negative, they have such a negative relationship with that part of the body that is not doing what is expected to be normal, what's expected to be do, what they see all their friends are doing. And there is that real feeling of not only the emotional and physical pain and suffering, but the disconnect with that part of their body that is just not showing up for them in the way that they had expected. And I think that you mentioned that with respect to endometriosis, I think it really applies to so many women's health pathologies, because there is the expected assumption that your body will just do what it's meant to do, what you see with all your friends, what you see in movies and on TV, that, someone wants to get pregnant and they automatically get pregnant. Someone, is, I don't know, whatever it is, or the reverse is that it's made light of, or it is it becomes like a stereotype of the woman with PMS, the woman with menopause symptoms, the woman with and so either it's sort of made light of and it's sort of made fun of, or it's just assumed that the way your body is meant to work is just going to work. And so there are so many layers of what a woman experiences. Specifically, I've seen this with fertility challenges, but in general, of being taken seriously, having the pain and suffering, but not being victimized, the assumptions of what your body should and shouldn't do, and then the social discourse around the sort of making fun of, maybe making fun of is not the right way, but the sort of being stereotyped as the woman with. And all of that comes into play when we're talking about women's health, hormonal health, conventional narrative, changing the narrative, changing the perceptions, changing the conversation.
Oh my God, so much there, Jacqueline. Like, really, you're very good at opening up big topics. I love it. No, they're important. They're really important. And actually, we don't talk about them enough in this space. I think we do a really good job of talking about all the advice and things. And we're talking kind of systemic stuff here, and identity of women as a collective. And so my response to that is like what the question I have bubbling up inside me, it's the same question around the pain piece, is like, where's the presence? Where's the softness? Where's our ability to the feminine energy? Like, as in, can we, and that's a skill to learn. It's like, when you're learning to dance, with partner dancing, you have to allow that masculine participating dancer to lead. And then the following piece, the person who follows, it looks easy, but it's actually harder than the leading piece. That feminine energy of inaction, of being with the journey, of just courting, of being with the unknown, of it's that kind of the via negativa, as Alexandra Pope talks about. It's the way of the unknown.
There's an element of surrender.
There's so much vulnerability in that, and there's uncertainty in, like, what you spoke to in my head, all of those stories and expectations and pressure. That's a lot of internalized patriarchy. That's just the language I use to explain what that is. Internalized expectations, a commercialization of the female body, viewing it as something that needs to produce a child, which I understand, like, if someone has a desire to have a kid, I'm not saying that that's like you're commercializing yourself, but it's not, right? But it's like, can we just take the pressure off and be with the grief in that. There's so much grief in the birth journey, you know, in whatever birthing journey you're on. You might be writing a book, there'd be grief in that, you know, there's disappointment in that. There's expectations and hopes and desires, and we want to control. But actually, at the end of the day, when we birth something, it's so different to how we expected it to be. And I'm sure it's the same when you actually have children. I don't have any children, but I know this journey, you know, so it's like, there's a lot of discomfort in that. And can we just be with our really uncomfortable feelings for a while? Like, without having to like apply all of this pressure. And, you know, that's kind of what I would say to that is there's a huge need. I think, yeah, you're right. We have to take action and look after our fertility and be clear on what we want, and, you know, use the medical system to support us, because we can get a lot of help from the medical system. But at the same time, we, like, our doctor isn't going to be saying to us, oh, you need to like also process all your feelings while you're going through IVF. You know, they're not going to say that, but that's what you got to do. Right. So like, there's a lot of, processing. We're not machines. We're very complex human beings with histories, with traumas, with collective, especially if you're in this group, you're a yoga teacher of sorts, or a leader or a coach, you're most likely highly intuitive, highly sensitive. You're also tapping into collective trauma, like collective wounds, the feminine wounding, right? So there's all that. And then
I also think understanding, sorry to interrupt, I think one of the things that is super important to understand is the woman's life cycle as a journey, because it's not static. And you mentioned it, and there is that very famous phrase of the only thing constant in a woman's life is change. It relates specifically to hormonal change, but I think it can be change on all levels. And understanding that life, specifically from a woman's health perspective, our life is a journey. Our hormones go through different cycles. We go through physical and emotional cycles, even as simple as our physicality. You know, our body changes shape. When you're a teenager, you look a certain way. When you're in your fertility years, you look a certain way. If you get pregnant, your body changes shape again. Post-pregnancy, your body is never the same, despite what the magazine images tell us, that after you have a baby, your body is never the same again. And as you enter perimenopause and menopause, your body again changes shape, you know, just very physically, but it's on all levels. We are in a constant process of change. Women's health is a journey, and we need to understand what those constant changes are, what that looks like, so that we can understand, as you said, what to expect. What are the expectations in each stage of that journey? How is our hormonal health changing? How is our physical, emotional health changing? What is the baggage we take with us on the journey? What is the baggage we want to drop along the journey? So yeah, I think maybe putting it in context of that is
it's so true, Jacqueline. Like, I think that if we try to keep it constant and to try to perfect it and to try to control it, it's, sorry, excuse my French in advance, but it's bullshit. It's bullshit, because it's just like we're setting ourselves up to fail. And I think the more we accept that piece that you're talking to, the more we accept that our ever-changing cyclical nature on all levels, physically, mentally, emotionally, spiritually, relationally, creatively, psychologically, and the more we can learn to regulate that in our system, and also have agency with what we want change to look like for us and how we invite it into our lives, because I don't think it just happens. I think we do have some agency. The more serenity we can have on the journey. And I think when it comes to like that, again, that feminist language, like one of my feminist friends, she doesn't use the term inner critic, she uses the term inner patriarch, like all of the thinking, right? It's like internalized. It's not even your own inner critic. It's just all of the shit we've taken in from other, you know, the social system. For us to like constantly be comparing ourselves to other women, like we need to stop doing that. We need to like just see that as our internalized patriarchal thinking and get rid of it and come back to what's actually our true nature as cyclical women, and being okay with not having it all sorted, you know, and feeling.
And I unfortunately, I think social media has actually reinforced that need, or sort of internal voice, internal critic, to compare, to, you know, if you just
yeah, and they make a lot of money.
yeah.
They make a lot of money by getting us into, and these social media, by the way, just while we're on the topic of social media, I love social media and I love Netflix, right? However,
And we are on social media, so we've got to give it a credit.
Yeah, but we're using it for change, right? So that's different. Like, we're being smart here. We're being really smart. But like, that's where the discernment comes in, and the tracking, and like looking at our relationship with it. That's you know, where we're discerning it. But the companies like Netflix and, you know, all the big social media companies, they have like teams, boardrooms full of psychologists and all these neuroscientists who literally have built systems to hijack our dopamine brain response system. So willpower sometimes, and telling ourselves to not compare sometimes isn't going to be enough. Sometimes we have to take, if you're on your period, this is my advice, if you're on your period or premenstrual, or you have PMDD, or you have a really vulnerable inner spring, which I tend to have, remove the patriarchal crap, like just delete, like remove Instagram from your phone for a few days, or just don't go on your phone. Like, create a strong boundary for yourself, because sometimes that kind of like self-talk or the mindset work isn't enough, because you're dealing with like roomfuls of neuroscientists, and my mindset isn't big enough to fight. You know, it's kind of David and Goliath. It's not enough. So we got to have boundaries, and then be really clear on our relationship with social media.
So because you mentioned it, I want to ask you for maybe some practical strategies, 3 to 5, let's say 3, real practical strategies for, not for changing the narrative and changing the conversation, because I think women or people listening to us understand that, but more on how do we, as you've used the word, you know, get agency over our own women's health. In addition to Western medicine, in addition to all the other things out there, do you have sort of 3 strategies or 3 really practical tips that you could recommend for women who, you know, want to create more hormonal balance, want to have more connection to their cycle, want to be more engaged and create space, or, you know, take a bit more control over their women's health?
Yeah, gotcha. Okay. I'll come at this from different angles, if that's okay. So practically speaking, just in terms of hormones, and I'm sure everyone already knows this, it's really, you know, basic stuff, but it's important. And I have to remind myself, healthy fats in your diet is really crucial in every meal, if you can, because it's just a game changer. Okay. So avocados, walnuts, fish,
coconut oil,
your coconut yogurt, your almond butters, if you eat dairy, you know, those things, animal fats too, if you eat them. But yeah, healthy fats as much as you can. And it's just a game changer for your hormonal health. And then obviously, like, because it's the thing, oh, fats are bad. No, you know, so let's just like get rid of that myth, and fats are healthy and they're important. So that's important. The second one would be, you talked about agency, is to keep the word relationship on the forefront of your mind, like relationship with. So, oh, what is my and question that, like, what is my relationship with my suffering, or what is my relationship with if you have a diagnosis of endometriosis, and what do you want it to be? Like, if you're in a relationship with someone, you get to decide, you know, part of it. So it's the same thing with things in your life. Like, if you want to have social media, like, what do you want your relationship to be like with that, you know? So, or what do you want your relationship to be like with your doctor? And like, we have so much power. We can manifest better relationships with things in our life, you know? So to think about that word. And the third one that came to mind is take your time. There's like, if you're wanting to change things for yourself or your clients or your business, like, in my opinion, from my experience as well, my feminist practice is to really take my time. I give myself lots of time to process my feelings, my thoughts, sit with my uncomfortable emotions. I try to not make decisions from a place of needing to escape uncomfortable emotions, as tempting as that is. I've had to do this hard, like, because of making mistakes, to like just take my time, give myself lots of space. There is no rush. I think what's more important is giving space and time to my nervous system, and then my authentic decisions will be born out of that when the time is right. So healthy fats, relationships, time.
Cool.
Yeah.
I'm going to share my 3.
Yay.
The first is, don't underestimate the impact of stress on your, and it doesn't have to be trauma stress, like some big trauma in your life, and it doesn't have to be the, oh my God, I'm so stressed out, I've got to, you know, run here, run there, take the kids, da, 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 da. There are different types of stress. And often we don't even realize that we are just constantly living in a constant state of low grade stress. Whether, you know, in today's modern society, we just do live with this constant state of stress. And I don't think we really understand the impact of all the different types of stress, big stress, little stress, trauma triggered stress, on our health and well-being. And I think if we can reduce that stress through all different techniques, whether it be, you know, meditation, yoga, going for walks in nature, 101 different ways that you can navigate and manage stress. I think that we need to really understand the role that stress plays in our health and well-being, and in our hormonal balance. So that's one. I think the second thing is understanding that, very unfortunately, again, not to over-bash the medical healthcare system, but sometimes your doctor is not intentionally doing wrong by you. They just don't know. They just don't understand the way that women's health issues show up. They haven't been trained in the nuances. They don't have the information. They are coming to you in the best way they can. But I think sometimes we need to know that that is one way to get answers and to get support. And I hear repeatedly from my clients, specifically women in perimenopause who are dealing with menopause symptoms, but not only, that they go to their doctors and they're just not, specifically in perimenopause, they're not getting the answers they need, the validation, they are not being heard, because perimenopause training and menopause training is pretty much non-existent in medical training programs, in the way that women need it to be present today. So I think that's the second one, is that go get what you need. But, and also we know, we haven't even mentioned this, that it can take between 5 and 11 years for a woman to be diagnosed medically with either endometriosis or PCOS. So a woman can be suffering that number of years, keep going to the doctor and not getting the answers she needs and thinking she's crazy. And we both know this, and we both know the statistics around this, that you know, these women's health issues are not recognized enough by the medical health care profession. So just have that information, have that awareness in your head, have that knowledge that you are not crazy, they are not intentionally doing wrong by you, and if it doesn't feel right, go get a second opinion and a third opinion, and go find the answers that you need from the specialists that, you know, that specialize in these things. So that is my number 2 tip. I know, maybe a little bit overwhelming. And the third thing is, obviously, because we are here as yoga teachers, yoga therapists in the Yoga Teachers Forum, and talking about it from partly from a yoga perspective, is specifically for yoga teachers, is create the space, have the understanding of, as we've talked about, the women's health journey, and create space for all the different stages that your students or clients may be at, and really get comfortable with talking the language of women's health, hormonal health, and the understanding the changes, the stages, the journey that that includes. Is that a bit too overarching?
No, I love the passion. It's so good. It's so important. I was thinking, I was like, yeah, like I had to definitely lower my expectations around emotional support from my doctors, you know? So, and I've seen clients say to me like, oh, well, my doctor's really nice. It's like, yeah, we don't really need a nice doctor. You need a, you know, a doctor who knows what they're doing. And like, sometimes we need to go in with being clear on what we want and just getting that, and then getting our emotional needs met elsewhere, which is really important, you know? So yeah, just to be really clear on like the role that your doctor plays and like what you need, and getting that, and being able to like hold your discomfort of the systemic misogyny that you might feel in the doctor's office. That's there, not like it's not there. So it's there and it's coming through them. Like it's not personal, it's just the way it is. So we just have to kind of go gently on ourselves on that journey. Yeah.
Okay, I think we're coming to the end or close to the end of our discussion. Is there anything else you really want to add? Anything else that you're doing that you want to share?
Yeah, I will. Thank you, Jacqueline. I'm doing a menstrual cycle professional training and facilitation. That's 6 months long. It starts in October. So there's loads of time to read about it, to talk to me about it, to sign up. I'm taking names for my waiting list. And we're starting in October. So that's all on my website. My website is currently going through a change, but you can get it at yourcyclematters.com, and I'll send you the link and you can share.
Yes. Yourcyclematters.com.
Yeah.
Okay. Yeah. And I know that you're on all social media as Lisa de Jong. So if anyone wants to reach out to you, they can.
Yeah.
I will just let everyone know again about my Women's Hormonal Health 4-part series that is happening in March, every Sunday in March. We will be looking at a lot of what we've talked about here, the hormonal health cycle, PCOS, endometriosis, and infertility from a biological, physical, emotional perspective, and from a yoga perspective, how yoga teachers and therapists using all this understanding and knowledge and information can really create space to support their students and clients, and very practical things that you can add into your yoga sessions. So poses and techniques and how to really use yoga as that tool to help people navigate any of those conditions. So I will also add that link in the comments. We have some people here listening to us in Zoom. So if you have any questions, now is the time to ask. I'm also going to go and have a look in Facebook and see if anyone has mentioned anything, or if there are any comments that have come up while we have been talking. So let's have a look and see. Give me a minute to check. I can't see any comments here. And for people who are listening in the Zoom, we don't have any questions. I know there was a question that was asked to me previously by someone who had registered about practical strategies, but I think we've sort of touched on lots of different things in terms of very practical strategies. And I think we've given a sort of broad-based understanding of sort of the approach of changing that perception around women's health. So
and if anyone is interested in going into cycle awareness in more depth, I do have some free resources on my website that you can check out. There's a cycle tracker, and I have a free course for endometriosis and another free course for nervous system regulation. So you can hop on over and check it out.
Okay, well, thank you so much for being patient with my tardiness. It was not my fault, and there was quite a bad accident, which thank God I passed, but I appreciate you all being patient. I hope it was worthwhile.
People stayed. We've got the same people from the start to finish, so it must have been.
Thank you, everyone. And thank you, Lisa. I really, really have loved talking to you and getting to know you over the last while as we've been preparing this. So
we should do it again. It's fun.
Yay!
It's a great conversation. I love the energy. It's so fun to talk about these things. Yeah.
Okay. Well, thank you, everyone. I'm stopping our live stream. Thank you.